So, the topic we are about to see is sedation in dentistry. So, what we will be seeing is what is sedation, who are indicated, drugs used usually, patient evaluation, patient monitoring, informed consent, and discharge. Generally, what is anesthesia? The practice of various psychological, physical, and chemical approaches to the prevention and treatment of preoperative and postoperative anxiety and pain. So, in this definition, you got to understand one point. It is not only physical and chemical methods, it is about psychological methods also. And as well, it is not about controlling the pain, it is about controlling the anxiety and pain. That is an important point here. It is about controlling anxiety and pain. So, the levels of anesthesia goes like this. So, there is local anesthesia, there is conscious sedation, then it becomes deep sedation, then it becomes general anesthesia. So, local anesthesia, it deals with the peripheral nervous system, whereas conscious sedation, deep sedation, and general anesthesia deals with the central nervous system, which means the brain. So, the spectrum of pain and anxiety control. So, it starts from no anesthesia. So, there is hypnosis, there is local anesthesia, there is nitrous oxide sedation, then comes oral sedation, IM sedation, IV sedation, then the unconsciousness begins. So, there is IV sedation, there is inhalational methods, there is general anesthesia. So, this is how the hierarchy of pain and anxiety control is established. So, what we are going to see in elaboration is conscious sedation. So, the indication goes like that: behaviorally challenged patients, stressful and fearful patients, young children, mentally retarded patients, major operations in oral and maxillofacial surgery, stressful procedures, gagging reflexes, local anesthesia problems, medically compromised patients. So, this slide is relatively important. This slide speaks about the difference between a conscious sedation and a deep sedation. And the signs and symptoms are quite overlapping. So, it is necessary to understand what is the physical differences between conscious sedation and deep sedation. So, conscious sedation deals with anxiolysis. The anxiety comes under control, whereas deep sedation, it is a sleep-like state. The patient goes into a sleep-like state. The patient is interactive in conscious sedation, whereas in deep sedation, the patient is not interactive. The patient is arousable in conscious sedation, he is not arousable in deep sedation. So, airway is properly maintained by the patient itself. So, inability to maintain a physical airway, that's the problem with deep sedation. Protective reflexes are intact. Partial loss of reflexes is being exhibited in a case of a deep sedation. So, responses to command are intact. Difficulty to respond to command. So, this part is very important to understand. So, we find that it is overlapping. The signs and symptoms of conscious sedation and deep sedation are quite overlapping. A patient begins with conscious sedation. If the sedating material or if the sedating substances are continuously intruded into the patient might go for a deep sedation also. So, it is necessary to understand where to begin, where to stop in case of a conscious sedation. So, there is different sedation techniques. This term titrating is quite important. This is a pharmacological term. It is about driving the drug into the patient according to the desired effect produced in the patient. So, what do you mean by this term, titrating? So, we give the patient a desired drug actually, which produces the desired effect, and the patient receives the drug there. So, once the desired effect is produced, we are capable of stopping the drug. This is called as titrating. So we introduce the drug into the patient's body. Once the desired effect is produced, then we stop giving the drug. This is called as titrating of the drug. Generally, the oral drugs that we take, for example, paracetamol 650 milligrams, amoxicillin 500 milligrams, these are all non-titratable techniques. It is generalized to be given to the population. 500 milligrams amoxicillin is meant for all the adults. 650 milligrams paracetamol is meant for all the adults. It is a non-titratable technique, and the result, the effects produced by the drug is different for different patients. Not necessarily the same kind of effect is produced with the different patients. So a oral sedation, which is a rectal sedation, intramuscular sedation, submucosal, intranasal sedation, all these are non-titratable techniques. The effect that is produced is different for different patients. A titrable technique is inhalation sedation, intravenous sedation. The titrable technique, what happens is that the drug is introduced into the patient's body. Once the desired effect is produced, it is stopped. What does it mean is that, for example, paracetamol, we start with 100 milligrams of giving paracetamol to one patient, and patient number A. There is patient B. We start with 100 milligrams of paracetamol for patient B. Patient C, we start with 100 milligrams of paracetamol for patient C. So we increase the dose of the drug. So patient A, he receives 250 milligrams of paracetamol, then the desired effect is produced. The pain stops completely. So for him, the desired drug is 250 milligrams. Patient B, the drug is given, 350 milligrams is reached, the desired effect is produced. Patient B, the desired effect is produced by 350 milligrams. Patient C, the patient is given 500 milligrams, the desired effect is produced. I mean, the pain is stopped. So this is about titrating the drug for different patients. So this is possible only in case of inhalation sedation, intravenous sedation. So in sedation also there is titratable technique, there is non-titratable techniques. First we start with oral sedation. It is the most universally accepted and easiest method of sedation administration. So the most variable or non-titratable technique is this. Recovery time is prolonged, difficult to reverse the unwanted effect, and escort is needed to transport the patient. No repeated dose are possible in this method. Advantages of oral sedation is that universal acceptability is that ease of administration, the low cost of the drug, incidence of adverse reaction is lesser than other techniques, no needles, syringes or special techniques is needed, various drugs and dosage forms are available, allergic reactions are less severe than parenteral administration, and no specialized training is needed in case of oral sedation. So this slide is quite understandable. So the disadvantages of oral route is that the reliance on patient cooperation. The patient has to be cooperative enough to take the drug. It might take a prolonged onset. Erratic absorption, unpredictable effect might happen. Inability to titrate the effect. Inability to readily lighten or deepen the drug levels. Prolonged duration might happen. Adverse interactions of the sedative drugs might happen. Next comes inhalation sedation, and this is the most commonest method of sedation that is being routinely followed in the clinical terms. Inhalational sedation. The most commonest drug that is used is that nitrous oxide in combination with oxygen. So nitrous oxide oxygen inhalation sedation is the most commonly used technique in dentistry for sedation. So nitrous oxide oxygen sedation is a combination of these drugs that the patient inhales to help eliminate fear and to help the patient relax. So nitrous oxide and oxygen combination, in which nitrous oxide is meant to produce the sedation, oxygen is given as a combination. The patient inhales these drugs and goes in for a sedated state. The equipments that are needed are continuous flow design with flow meters, safe delivery of oxygen and nitrous oxide, efficient scavenger. So these are the equipments that are needed in case of a inhalation sedation. At this point, you got to understand a black color cylinder with a white color solder is an oxygen cylinder. The other cylinder is a nitrous oxide cylinder. So the equipment that is needed is relatively less competent. Actually, it's not a very a tough instrument which is used there. It is easy to understand the sedating instrument. A nasal mask is put on the patient. We can find the patient is crying. Slowly the patient goes in for a sedated state. So advantages of a nitrous oxide sedation: rapid onset, almost equal to that of an IV administration. Ability to titrate and to reverse. Depth of sedation is readily altered. A flexible duration of action. Rapid recovery from sedation. It is safe to use in the patient. No injection is required. Very few side effects are there. No adverse effects on vital organs. Patients can be discharged alone. It is non-addictive. Stage 1 anesthesia is produced, dulls the perception of the pain. The fourth point here: depth of sedation is readily altered, flexible duration of action, and the drug can be titrated and can be reversed also. What do you mean by that term? So I increase the dose of the sedating drug here, which means the nitrous oxide. I increase the dose. Once I desired effect is produced, I can stop the drug. I can start with oxygen. So I increase the dose of nitrous oxide, and once the desired effect, which means the stage 1 anesthesia, is produced in the patient, then I can stop giving nitrous oxide. I can start with oxygen. So the desired effect is produced, then the drug is stopped. Not necessarily a fixed dose has to be given for all the patient. Each patient requires a different amount of nitrous oxide dosage to produce a desired effect. If I want to reverse it back, I give him 100% oxygen. Slowly the nitrous oxide comes outside of his body. By expirating nitrous oxide, slowly the effect is reversed in that patient. This is how generally a nitrous oxide oxygen sedation is being done with any patient. So there are some disadvantages of nitrous oxide. Initial cost of the equipment is high. Continuing cost of the gases is high. So the cost makes a very big difference in case of a nitrous oxide. The weight goes upon the patient. We got to cost on the cost of the instrument, cost of the drug, everything goes on the patient's head. Equipment takes up an operatory space, requires constant patient cooperation. Chronic exposure of the office personnel can cause carcinogenicity, teratogenicity, or toxicity. Sometimes it is ineffective. Administration of inhalation sedation. So we start with pure oxygen while establishing the patient's tidal volume. Slowly titrate the nitrous oxide until the desired results are achieved. So titrating here, it means giving in a very small doses and increasing the dosage levels very slowly. Patient should refrain from talking or mouth breathing. He has to breathe through his nose now. The nitrous oxide oxygen analgesia should end with the administration of 100% oxygen for 3 to 5 minutes. So the anesthetic effect has to end by giving 100% of oxygen for 3 to 5 minutes. Obtain post-operative vital signs and compare them to that of the pre-operative recordings. Quite simple to understand. We start with oxygen and we finish with oxygen. In the middle we give him nitrous oxide. We titrate the nitrous oxide to reach the desired effect. The third one is intravenous sedation. So this is also a commonest way of sedating the patient, usually dealt by anesthetist, rather not by the dentist. Usually the anesthetist are equipped enough to give an intravenous sedation, and sometimes a qualified dentist also can give an intravenous sedation. Anti-anxiety drugs that are administered intravenously continuously throughout the procedure at a very slower rate, providing a deeper stage 1 analgesia. The most rapid technique, onset of the effect is about 20 to 25 seconds, that's all. In children under 6 years, the incidence of untoward effects is increased. The most commonest drug that is used to produce a sedation by intravenous method is diazeform and midazolam. So a diazeform is a benzodiazepine, produces sleepiness and relief of anxiety. Onset of action is 1 to 5 minutes. Half-life is 30 hours. Average sedating dose is 10 to 12 milligrams. Coming to midazolam, it's a soft-acting benzodiazepine, 4 times more potent than diazeform, produces sleepiness and relief of apprehension. Onset of action is 3 to 5 minutes. Half-life is 1 to 12 hours. Average sedating dose is 2.5 to 7.5 milligrams. And the most commonest drug that we use now is midazolam to produce intravenous sedation. So generally speaking, the pre-anesthetic examination, the physical examination is done, evaluation of anxiety level is being recorded, review of medical history, medications and drug allergies is recorded, assign a ASA classification, prior sedation anesthetic history is being recorded, informed consent is obtained from the patient, give pre-sedation anesthesia instructions, always have a consultation in the first appointment, then in the next appointment we can go with the procedure. So this is the American Society of Anesthesiologists physical classification. So 1A stands for normal healthy patients, 2A stands for patient with mild systemic diseases. 3A stands for patient with severe systemic diseases. 4A stands for patient with severe systemic disease that is a constant threat to life. 5A is a moribund patient who is not expected to survive without the operation. So this is a generalized classification, ASA physical classification. So intraoperative monitoring. So in the middle of procedure, we are supposed to do this one. Level of consciousness is being monitored. Clinical observation is done. Pulse oximetry is maintained. A stethoscope is maintained and his cardiac function is checked. The BP is recorded. ECG if needed is recorded. Monitoring oxygenation levels is being recorded. So while recovering, patient must be kept in office under observation until completely recovered. Check for the vital signs at least every 5 minutes and has to be recorded. So the BP, his heart rate, respiratory rate, oxygen saturation, level of consciousness, everything is being recorded in a KC. Sedated, anesthetized patient must be continuously monitored until discharge. So we got a broad understanding about the drugs that is used for sedation and titrating effects of the drug. The 3 methods of sedation, there is the oral sedation, inhalation sedation, intravenous sedation. So the chapter is a little lengthier, but what I've been speaking is a concise form of the chapter. So the post-sedation instructions, verbal and written instructions must be given to the escort upon discharge from the office. It should include the potential and anticipated post-sedation effects. Limitation of activity. So driving machinery shouldn't be done for at least 24 hours by the patient. So dietary precautions and suggestion has to be given to the patient. No other sedatings must be done for 24 hours. 24-hour contact number for the practitioner has to be given to the patient. So these are the post-sedation instructions that is given to the patient. Thank you.